it's Caloris. I'm your nurse today, and I need to do a head-to-toe assessment on you. Would that be okay to do that now? Okay, thank you. Alrighty. Could you give me your name and date of birth? Okay, and that matches with your ID bracelet. I'm going to sanitize my hands. Okay. And when I do this assessment, I wanted you to know that there are questions I'll be asking you. I will be using my hands to touch areas of your body. I will be using my stethoscope as well. I'm going to go ahead and put on a pair of gloves, and then we'll go ahead and get started. All right. So then I'll get the assessment here. Got my gloves on. And I'm going to start by, I'm going to inspect your head, your face, and your neck. That's what I'm going to start out with. Okay, so with your head, I'm looking, looking at your hair, the texture. I'm palpating around on your scalp for the roundness of it. Okay. Then I'm looking at your eyes and your eyebrows, your eyelids, how it all coordinates, your nose. I'm looking at all of that. And then we'll go ahead and I'm looking at your ears. I just want to palpate them. And look inside if you had any earaches or anything. And we'll palpate this side. Okay, you haven't? That's good. Okay. Do you have any hearing problems or anything? Well, that's good too. So what I'm going to do, I'm going to get behind you. And what I'm going to do is I want you to cover up one of your ears. I'm going to ask you a question. I want you to repeat it. 57. Okay, thank you. Cover up the other ear. 19. Okay, thank you for that. Alrighty. So then, looking at your eyes. So I want you to just look straight ahead. You can, and what I'm gonna do, I would dim the light. And then I'm gonna come in from the side and check her eyes. Okay, we'll check this side. Okay, now I want you to keep your head still and I want you to follow the light. So we are gonna look down and to the left. Okay, how about just look down? And we're gonna look, okay, yep, look up. Okay, good job. Just look over. Okay, and we're going to do the same thing with this eye. So, yes. Now look down for me. Okay. And look up. Now I want you to look at the pen light and I want you to just, okay, very good. Now I'm going to move on down to your nose. Can you put your finger or something over one of your nostrils, and I'm going to look up there. Breathe for me. Okay. Yes, there you go. And I'm checking in your nares there. We're going to check in the other one. Put your hand over your other one. Okay. Very good. Alrighty. Then I want to check your mouth. I'm looking at your lips. I want you to open your mouth for me. Okay, can you stick your tongue out? Just say, ah. All right. Look at your hard palate. Can you lift your tongue up? How about move it from side to side? Okay, any sore throats or anything? No? Okay. Well, thank you. I do want to, let's see, let me check your sinuses. And I want to see on your joints here. I want to palpate around all that. Okay. Then now I want to ask you, can you frown for me? Okay. Okay. Grit your teeth for me. Okay. Then, yeah. Right. While I'm feeling. Okay. Thank you. Then let me see. Well, puff out your cheeks. Okay. Thank you. Now we're gonna go on down to your neck. I do want to look at your neck, so I'm gonna ask you to you turn your head for me, and I'm gonna check that. Okay. And I've turned the light back on too. All right, this side. All right, and then we're gonna feel around there, and then I also wanna check your carotid pulse. Okay, now I'm gonna check this side. Okay, very good. Now we'll go on, and I'm looking at your shoulders. Okay, can you sit up? There you go. And I want you to shrug your shoulders while I'm pressing down. Okay, good job. All right, and then I'm gonna palpate on down to your arms. I do want to check your brachial pulse. Okay, and then we'll check the brachial pulse in this arm here. Okay. Then I want to do your radial pulse. And then we'll do the radial pulse over here. All right. As far as your fingers, I do want to check your capillary feel. Okay, and we'll check it there. Okay, I want you to put your fingers together. Okay, then separate them. Alrighty, I'm checking your joints, inspecting it. Okay, I want you to take your hand and press down while I'm doing the opposite. Okay, good job. And then with this one, I want you to press up. Okay, over here, we're going to do the same thing with your hand here. I've already checked your radial pulse. I want you to, I'm inspecting your fingers and your joints, your fingernails. I want you to put your fingers together and then separate them. Okay, and can you take your thumbs and touch each finger? Okay, good job. How about over here? Did you touch each finger? Okay, thank you. Then I want you to close your eyes. All right, and I want you to tell me, where do you feel that? Okay, yes, thank you. How about over here? Yes, that's in your hand. Yes, ma'am. Okay, thank you for that. I want you to hold your hands outside, that's right, to the side. Okay, and can you, in front of you, just put them in front. Okay, can you turn your hands up? Okay, hands down. Can you pull your arms up over your head? Okay, what about the back of your head? Up behind your back. That's good. Okay. Alrighty. Thank you. So now we'll go ahead. I am going to look at your chest. I'll have the rest of you. You're covered up here. And I'm going to go ahead and I'm inspecting it. Okay, then we're going to go ahead and we're going to palpate. Now, we need to remember how to get mammograms. Okay, so we'll do checking it in a circular. Okay, and then we'll check the other breast. And okay, it's good to do your self breast exam. We're checking for any lumps, any drainage. Okay, and thank you for that. All right. So now what I'm going to do is I'm going to listen to your breath sounds. Okay. Okay, so we'll go to here. Then we'll go to the pulmonary. Okay, then we'll go to Erb's point. We got your tricuspid valve. Listen. And then we'll go to the mitral valve. Now I will need to listen to this for a full minute, okay? Okay, and I do thank you for that. Now I'm going to listen to your lung sounds. Okay, so I want you to breathe. Okay, okay. Okay, deep breath, let it out. Okay, deep breath. Okay, deep breath. All right, deep breath. Okay, and I thank you for that. Okay, so then I want to come right behind you, and I'm going to inspect the posterior. I'm looking at your back. I'm looking at your shoulders, the whole makeup, you know, how it's all made up and the symmetrical of it, how it all lines up. I see how your neck lines up right in the center. Okay, now can you put your chin down to your chest? All right, how about if you can look, hold your head back as to look to the ceiling. Okay, are you able to take your ear to your shoulder? Okay, how about this side? Okay, how about turning your head? All right, so what I'm going to do, I'm going to go ahead and I'm going to listen to the posterior. Okay, raise your arm for me. Look at. Okay, we'll do the same. Okay, thank you for that. Also, while I'm doing it, and I'm watching as you're breathing, I'm watching my hand, you know, just the evenness of it as we go. I'm palpating. Okay, thank you for that. Alrighty, so now I'm going on down to your abdomen. Okay, when's your last bowel movement? Okay, thank you. Okay, so I'll start in the right lower quad. Okay. Okay, thank you for that. So I've inspected your stomach, I've auscultated. Now what I'm going to do is percuss. Okay, and I want you to let me know at any time if you feel any pain, okay? So, all right. Okay, no pain. So now I'm gonna palpate. We'll do it nice and light, and I want you to let me know if any pain. Okay, none there. None there. Okay, thank you. And none there. Okay, I'm gonna go a little deeper, and again, let me know if you feel any pain. None there. Okay, no pain. Okay, no pain. Good job. Okay, now I'm gonna check your femoral pulse. Okay, and we'll check your femoral pulse over here. Okay, thank you. So now we're going to look at your symphysis. What I'm going to wash, I'm going to take these gloves off because you want to put on clean gloves. Okay, and then you're going to wash your hands, put on clean gloves. All right, you want it nice, well-lit room. You want to be nice and covered except for the area that you're going to look at exposed. And what it is, I'm looking at the hair on the symphysis pubis. Okay, I'm looking at the distribution of it. Okay, I'm looking, you know, at the labias. I'm checking the skin, seeing if there is any drainage or any lesions. Okay, we're looking at the rectum, and we didn't see any of that. So, okay, skin is even, and I do thank you for that. I would take my gloves off, sanitize my hands, and go ahead and put on another pair of gloves, and then we'll go ahead and continue on. So now I do want to check your hip, and I just want you to, can you raise your leg up against me, okay? And then I want you to bend, and we'll go out, that's right, then we'll go in, and then how about bending it to the other knee, and then slide on down. Good job. Okay, we'll do the same thing. I want you to take your leg, we'll lift it up. Okay, we'll go down, we'll go out, we'll go in. Okay, then we'll bend to your knee, that's right, and let your foot slide right on down. Okay, thank you. All right, and I'm inspecting your skin. All right, I'm going to go ahead and I'm going to bend your knee, and I'm going to check your pulse. Okay, behind your knee, we'll check this pulse as well. Now, we'll check the other one. Okay, I'm going to go ahead, I'm going to check your dorsalis peds. Okay, we'll check the dorsalis peds from here. We'll check the post-talus tibia. And we'll check the post-talus tibia on this one. Okay. I'm going to check your capillary refill of your toes. Okay, good job. I'm going to check your ankles. They go in, they go out. Like press on my foot like you're pressing on an accelerator. Can you lift your toes up? Good job. We'll do the same thing with this one. I'll check your capillary refill. We'll go in, we'll go out. We'll do your ankles. See how that is. I want you to press on that one like you're pressing on the accelerator. Good job. And lift your toes up. All right. You're doing very good. Okay. Then what I want you to do, I want you to stand up for me. Then I'm going to ask you if you could bend over for me. I'm going to check your spine. Checking the alignment there, making sure it's straight. Okay, good job. Alrighty, and it is. Then, well, bent over. Now I want you to bend backwards for me. Okay, good job. Then I want you to walk 5 steps. Take 5 steps forward, and then I want you to walk back to me. Okay. Thank you. Now remember, I want you, keep on getting your colonoscopies. We want to keep you immunized, so remember to get your immunizations. As far as having safe sex, we have condoms, you have birth control. I'm going to dispose of my gloves. I'm going to sanitize my hands. And this concludes my physical. Thank you so much.